case number 1, she's a 70 years old gentleman who suddenly unresponsive with BP on the admission 220 or 110 millimeter mercury. He was intubated, and his best GCS we call is I1 verbal, was intubated, and motto is 5, means that it's localizing to pain. I think our medical students should be familiar with our GCS because they are doing the surgical rotation, and part of that we will see the cases in ward, in neuro cases, and also the ED cases, so GCS. And apart from that, this patient also had a background history of end-stage renal failure, hypertension, and also diabetes mellitus. This is a CT trait. We've shown that this patient is having large right ventricular hemorrhage. So, as my expertise, if CT scan show the ICB, intracranial bleed, which causing the mass effect, means that the patient has the, if you can see from CT scan, they also the midline shift to the contralateral, means that this patient has a raised ICP symptom, increased intracranial pressure. So the decision for surgical intervention should be made by a surgeon and also discuss with the family members. If we are not doing any intervention, if they call is a herniation, because our brain consists of 3 elements. So remember that Monroe-Calais doctrine, when there is a mass volume, it can cause an imbalance of the brain tissue and CSF. So if this imbalance happen, then they are called as the herniation. And the herniation can be from the subfalsa herniation, you can see. Also the last herniation stage is tonsillar herniation, where the patient is going to become a brain dead. So the decision must be discussed with the family members whether this patient should be operated. They agree to be operated because the aim for surgery is for life saving. Then patient will develop the hemiparesis, hemiplegia post-operative, impact consciousness, might be follow up with the tracheostomies, and regarding the nasogastric tube or PEG tube later on, the patient is going to become bedridden. But discussion must be done with the family members whether they have support, and also the patient any wills before that. If I'm 70 years old, I'm having the back cases and have to be tracheostomized, put a rest tube and also PEG tube and bedridden, I don't want to do it. So the discussion is about AMD, Advanced Medical Directive, or living will. So the case number 2, this is a 56 years old female who's presented with altered behavior, always came with altered sensorium, altered behavior. So the altered behavior because of patient impact consciousness because of frontal lobe lesion. You can see there's a right frontal lobe. So the patient can have altered sensorium, can recognize family members, can make a decision, hemiparesis, and difficult in speech impairment. So at the end, from the imaging and also from the histology, you can see that this patient is having the high-grade glioma. This is high-grade glioma consists of grade 3 and grade 4. And this is glioblastoma multiforme, the new term of WHO grade 4. Basically, this GBM is well known that this patient should have operation, should do the radiotherapy, and should have chemotherapy. And in the textbook said that even though with the 3 operation, radiotherapy, and chemotherapy, the life expectancy up to 18 months to 2 years. So the decision must be made. We have one case of an ENT surgeon. He's operating. Then my last in Kuantan, he's operating. Then he started to be unable to recall the instrument. He keep giving the different request. He want to do something, but he requests and something. Then people notice and started he had an altered sensorium. Then do the CT brain and also the MRI brain. So he's operated, and the HP revealed glioblastoma multiforme. He was done radiotherapy and also the chemotherapy. However, up to 2 years he passed away. Recently, last year. So this is case also that we have to decide whether this patient, if I'm having the terminally ill, whether my life expectancy is up to 2 years maximum. Then if there's anything happen with me within the 6 months to 10 years, I don't want to do any active resuscitation. I don't want to intubate. I don't want to be tracheostomized. So the patient decision. So he want to do the living will, the called is AMD. And another cases, these are trauma cases. So this is 20 years old male who's alleged motor vehicle accident, and he sustained a severe traumatic brain injury, was intubated, and GCS the best is E1 VTM1. E1 is eye not opening to any response. T is a patient with intubated. Motor 1 is no response instead of sedation. Instead, we give any pain stimulus, the patient is not moving at all. So this is M1. And also, when the patient came in the comatose, so we have to proceed with the brainstem assessment. So we start the brainstem assessment from to assess the function of midbrain, on-time, and so the medulla. So at the end, we assess that patient has pupillary response is non-reactive, there is no corneal reflex, there is no light reflex, and there is also there is no what we call the cat reflex, there is no cough reflex, and also there is no spontaneous breathing. So then we can say that this patient is going to become a brain death. However, the brain death must be diagnosed by they are formed to fill up by surgeon or the treating physician, either intensivist or they are the consultant that have NSR, then working in the practice is more than 5 years, and then have to fill up the form, must be done. Then after the confirm, then this patient can say that this patient is going to have brain death. So the CT scan show the left acute subdural hematoma. So in the term of this case, the decision by treating physician or intensivist whether this patient we should extubate it or just give the patient until the last breath. Means that this patient should discuss with family members. Okay, we can have because of the patient's loss of brainstem function, then we can terminally extubate this patient, or can let the patient, because of family sometimes request, I want to wait all my family members around before take out the tube. They are decision, they are requested by family members because they want to see once this patient is being take out the endotracheal tube, then the patient doesn't have any spontaneous breathing. Once we take out, then the brain will be shallow. You know the chin stroke breathing from the herniation to the tonsilla, brainstem herniation, chin stroke. Then once we take out the ETT tube, the patient may be succumbed to death. So the decision either to extubate in the emergency or transfer back home, sometimes extubate in ward and give the family member to end of life care, or the patient sometimes the family member still unacceptable, asked to wait, continue the ventilation. We know this patient will be dead, so continue ventilation. The patient can ventilate, but there is no any benefit to the patient also. And part of that, the concern in our setting is ICU bed. Is it when patient be put in ICU, this patient doesn't have any intervention, so sometimes the anesthetist decided this patient cannot be put in ICU because of brain death. So the space in ICU will occupied by him, and the patient, other patient that is really needed for ICU bed cannot enter the ICU because of ventilate this patient. So this is a same example of 3 cases I give for discussion. I will discuss. I just showed what is AMD. AMD is a legal document that patient or family members or been signed in advance to inform the doctor that threaten you in the event that you become terminally ill and unconscious, that you do not want any extraordinary life-sustaining treatment to be used to prolong your life. Nowadays, there are a lot of things that you can do. For me, example, I have a patient. We have degenerative disease like Parkinson's disease, any Parkinson's disease. Patient have disability because of the Parkinson and 4 cardinal signs. Patient is rigidity, any tremors, and sometimes you cannot stiff, cannot stand up. And I have one of we invent a new, it's not really new, but we invent one of the procedure we call it deep brain stimulation. We put the electrode into the subthalamic nucleus, and I'm doing the cases in the USM. So when we put the deep brain stimulation, after the deep brain stimulation, the patient is about 65 and 75. After the implantation, the DBS, so patient can walk, patient can do his life, can cooking, even can drive up to 70. So sometimes the decision, the understanding of the disease, and now the invention of the new technologies, new studies to sometimes to prolong our life. So there's certain. Then making an AMD is a voluntary decision. It's entire up to you whether you wish to make one. In fact, it's a criminal offense for a person to force you to make one against your will. This is based on Minister of Health in Singapore, because the Singapore already started this AMD. Last, because of the cases of their previous Prime Minister, Lee Kuan Yew. Then they started to implement, they put in the parliamentary, so become an act. So in our setting, still new, and this is article was done in 2020 regarding the honorary wish of patient and Islamic view of implementation advanced medical directive in Malaysia. So they are still new to give our patient understanding first, and also even to give our physician, any surgeon, any medical practitioners, any GPs to understand what is the advanced medical directive. And this book, Fiqh and Arahan Perubatan Awal. Arahan Perubatan Awal is a term of advanced medical directive written by our IKIM, because they have Muzakarah in 2015 and 2017. One of the panel in Muzakarah is our intensivist consultant, Prof. Dr. Arif. He was involved in this discussion. So this discussion, I think I will give a bit of brief of summary after this discussion, where in the conclusion, this AMD is harus, because it's harus. Although AMD is necessary, its implementation involves other elements that require more detailed attention. The three issues are patient autonomy in making AMD decision, recognize patient cognitive ability and authority of a representative to make decision on behalf of a patient who lacks decision-making capacity. So, in my case, in my problem with the patient is decision-making regarding cognitive ability. As I mentioned before, it's a deficit, a neurological deficit, because of sometimes patient came in because of unconscious or impact consciousness, or can have the cognitive impairment, frontal lobe syndrome. So, the patient must have a good cognitive capacity to understand and make medical decision in AMD, and medical decision in AMD need to be made through sufficient discussion and not in hasty manner, not in tergesa-gesa. You have to understand, discuss with family members, discuss with any relative, waris, regarding family member, what are their decision. We as a surgeon always think that operation is the best as a surgeon. But part of the operation you have to go to medical treatment. Sometimes we can go for any palliative and intervention. But the decision made in AMD are not absolute. It's not absolute. They need to be constantly updated to be in line with the latest medical development and also in the Sharia, Islamic principle of Sharia. And the appointment of a representative must take into account the list of guardianship outlined by Sharia. In this book, there are one topic regarding the wali, or the guardianship. Who is the waris or wali that can give if patient is unconscious, they are, based on a law, there are list of wali that can give a decision. Sometimes the problem occur when patient came in, suddenly know that his patient already married, 2 or 3 wife, then suddenly there are difficulty, debatable decision making. So now I have encountered that cases, then they are quarreling among themselves outside the ICU, then we have difficulty to wait time to give a decision because this is an acute. Is it to operate or not to operate? So the collective consultation and discussion involving relative, guardian, and family members with a treating doctor are important to avoid any disputes in making the best decision for the patient. Continuous and collective input from various fields such as medicine, ethics, law, and religion needs to be in line with the religious requirement and current development. So decision must involve medicine, ethics, and law, and part of the religion. So we are not doing anything, and if the patient have any consent that they want to they refuse or they want to proceed with an surgical intervention, then from our side, yeah, we keen to operate this patient because we think this patient will benefit. But sometimes the patient decision, they think that they don't want to pursue their life because they think the problem later on, which can be bedridden, no family member can take care of them. The problem with the financial, you need to buy all the equipment for the rehab. So the decision you can give to the patient, and then now we have what we call consent, refusal from consent, everything. So if they refuse, then have to get a refusal consent. But the person who going to sign off the consent is based on the law, the one. So I'm that later on I will give to Prof. Abdulahi to continue the further presentation about the AMD in terms of Sharia perspective. Thank you.
Always an issue, and that's why we have to discuss it, because I think Dr. Ghaddafi mentioned a very good question. Why it's an issue, AMD? Why it become an issue? Why it should be discussed? It should be discussed because there are 3 dimensions. Number 1, you remember seeking medical treatment. One of the questions is seeking medical treatment. Is it wajib or sunnah or makruh or mubah? You know, I'm just showing off my Bahasa Arab. Huh? Don't worry about it. So is it must to seek medical treatment, or is it recommended, or is it just something that is permissible whether you do it or don't? So that's number 1. Because you remember the prophetic hadith in which the Prophet ﷺ said, "Ibad Allahi tadawu," or the servants of Allah, means mankind, seek medical treatment. So that is statement of the Prophet ﷺ. Is it carrying the weight or the value of that statement? Does it mean we must seek remedy or medical treatment wherever we get sick? Or is just like a general directive? Whenever you get unwell or illness is there, seek treatment. It's just advisory or recommendation, or is it wajib, like wa aqimu salata wa atu zakat, right? So that's number 1. Number 2, because if we say that hadith carries the weight of, I use this word, wajibizing or prescribing, medical treatment, then AMD would be in trouble. You have no role anymore to say, look, if I'm ill, medical doctor, please don't provide medical treatment. There is no role, there is no choice here, right? Same like we don't have to pray salat or not to perform it, right? So that's number 1. Number 2, the other issue is respecting medical specialty. In other words, we have established medical schools, medical faculties, developed it, conducted research, clinical trials and so forth. So if we say that we have to listen only to what the patient wants, then what is the role of the medical doctor then? And you remember, for example, so many other ayat and hadith, but I'm just reminding you, in chapter 16, Surah Al-Nahl, verse number 43, and also chapter 21, if you can check please, you have the Mus'haf with you, please check. And also chapter 21, I think verse number 6 or 7, Allah subhanahu wa ta'ala mentions there, فَاسْأَلُوا أَهْلَ الذِّكْرِ إِن كُنْتُمْ لَا تَعْلَمُونَ. That's chapter, I think more explicit, chapter 16, verse number 43. وَمَا أَرْسَلْنَا مِنْ قَبْلِكَ إِلَّا رِجَالًا نُوحِي إِلَيْهِمْ فَاسْأَلُوا أَهْلَ الذِّكْرِ. In other words, it means ask those who have knowledge if you do not know. So in other words, that means as a patient, I should consult my medical doctor and I should listen to his advice. Therefore, whether I have role, to play in my medical treatment or not, then what about this ayah? If the medical doctor have to follow what I want as a patient, what about this ayah? The ayah tells me, if you do not know, ask those who know. So I should, in that case, in that ayah, as a patient, I should listen to my medical doctor. What he tells me, I'll just follow, because he is being trusted, trained, and educated for these kind of cases. But if we listen the other way, you see here, because we said respect the patient's will, right? If we go the other way, are we turning the ayah the other way? So it's an issue there. There is an issue there. Then the whole profession of medicine becomes what? Questioned. If we just ignore the medical doctor's advices, right? So there is an issue there. Number three, the third issue, which is a burning issue, is yes, we treat the patients as a human being, and we will see some examples there. So if we say like, look, you are my patient, so just listen to what I am saying. In other words, are we treating them like an object, whereby they have no will, they have no role, in the, the treatment, whereby the individual here may feel harmed if we provide to them certain medical treatments. And the prophetic hadith tells us, La darara wa la dirar, right? There should be no, harm should not be inflicted, not reciprocated, right? We should not inflict harm to anyone. And now, as a medical doctor, if you just say, my treatment is like, I will use that word, sorry about it, Jalan Sahala, means you just listen to me, one-way direction, there's no interaction, then the patient's will and human feelings are not respected, right, and counted. So there is an issue. So with that issue, with that three issues, the issue of AMD is always an issue, not only in medical setting but also in legal settings as well, right? Well, very quick, I have gone through the literature available on this topic, and I think I concur with what Dr. Ghaddafi mentioned. I have seen this literature which I already quoted. You can get it, and by the way, I just saved my slides and also these three articles on the desktop. So later on you can access and download and see. So you can see it becomes wajib now, especially if it is infectious disease and the public is going to be affected. So then it becomes wajib to treat that COVID-19 and so forth, right? We remember those stories. It may become, they said, optional, number three. It may become preferable. It may become prohibited. One is, because you are involved, like, some haram things. So basically, the idea of is it wajib to seek medical treatment or not, we have these, classifications that the ulama gave. So which one you want to fit is there. So that case, AMD, if let us say somebody is suffering with, a treatable disease, which may become also infectious, then that means we do not regard, the AMD anymore, right? Because this is where the medical intervention is wajib now, right? But other stages, maybe you can say, is still open for discussion, as you can see from this, literature. Number two, what about respecting patient's wish? Is it acceptable in Islam or not acceptable? By the way, this is not my fatwa. This is the literature that I have read, and I share with you the literature, the hadith and the ayat as well. Look, remember when Rasulullah sallallahu alaihi wasallam, was there during his demise, before his death, he was ill before his demise. Then what happened is, his relatives, including Aisha, Abbas ibn Abdul Muttalib, and others, they were around as he was sick. I want you to focus on this hadith because it tells a lot. And then what they did, they pour medicine on his mouth when Rasulullah sallallahu alaihi wasallam became unconscious. Then he became conscious. Then he told them not to do anymore, stop. Then he became unconscious. Then they put the medication again. And then when he become conscious, he tell them, did I not prohibit you to do this? In other words, there is AMD here. As if the Prophet ﷺ don't want to receive any treatment from them. So you see the hadith. Did I not forbid you from putting medicine by force into my mouth? All of you, if you don't listen to me, the Prophet is now questioning them and criticizing them. You see here? If you don't listen to me, all of you will be forced to take medicine into mouth, except Abbas ibn Abdul Muttalib, who was there. Why? Because he was not witnessing, he has not witnessed your deeds. In other words, only Abbas ibn Abdul Muttalib was not involved. His uncle, the Prophet's uncle, was not involved on forcing the Prophet to have that, medicine poured on his mouth. In other words, as if now the Prophet is now having AMD. In other words, no intervention, please. Let me, as if. This is not my fatwa. It's very hard actually. You notice my position. I'm just trying to understand the text there. This is authentic hadith, and it is there. You will see it in the literature. So as if the Prophet is telling them, wait, don't pour any medication on, or no intervention, in other words. So from there you can see here now, it can be inferred, as you can see here from the Prophet tradition, that in Islam does not prohibit, you see, the implementation of AMD. Because this is what the Prophet ﷺ did. He told them not to do anything. So AMD in that sense is not prohibited in Islam. In other words, although initially it shows that, I'm finishing. I'm finishing. Yes. So therefore, these are the conditions now. You can see. Then what the ulama did, in order to respect the patient's will and also to fulfill the medical treatment, they provide this kind of conditions. A person is suffering from chronic disease, a person who is terminally ill and imminent, facing what? Death is imminent. Person, same like what Dr. Ghaddafi just mentioned, right? So, as you can see here, regarding this matter, following the Islamic ruling from Kingdom of Jordan, for example, they say there is no prohibition in Islam to refrain, from putting a cancer patient, for example, a life support. So I leave this one for your reading. But even I think in Malaysia, as Dr. Ghaddafi mentioned, we are yet to have a law that is governing AMD. But in my reading on the available literature, they said that, cases are being settled on the common law, or they say it's like more like, it's like, it's the wisdom, the general wisdom. Why? Because it's yet, I think, to be addressed, and I think it's still underdeveloped. So later on you can read this statement, one way of finishing it. So this is actually the conclusion about it. So in other words, there is no clear no, and there is no clear wajib. But it's still things are left to the condition and the cases that you have. With that, I like to